Okay, I did, for Marjorie, I did find this PowerPoint. It's just short, just in terms of thinking of thematically. So, you know, you look at yourself as the father did in this picture as a starter point, and what are our biases, and how do we unveil them and then manage them. So we have to look inwardly about what have been your experiences, what individual biases do you have, do you avoid a person with a disability? How would you answer a young child who says, what's wrong with him or her? If he sees a child with a disability. And would you invite a person with a disability to come to your home, go out with you? Your whole emotional intelligence will guide you on this, and what is that, and how does it apply to the subject of disability awareness? First, we have to really understand our own motivations and how we are ourselves and our own motivations. We then have to really work on empathy and understanding others that we're working with, and that doesn't matter whether you're working with an adult, acute, ortho, or children. And what are your social skills? And, you know, as an example is that in the world of pediatrics, you know, you really ought to have some social skills ready to use in your back pocket. And most of it is nothing elaborate. You just need to be able to listen and have empathy and to respond to the children, because you don't direct them so much. You are, you know, it's very interactive, as we've explored. So when we're thinking of all of our children, we think of the children as individuals. We look at our own education experience and biases. How do we communicate? How do we let ourselves be known? I think I've said this to you. I've had graduate students that start with me, and maybe they haven't been in this class, or maybe they have been, but I can tell that they're like, you know, they don't know what to do. And I think some of you have had the experience in the Renaissance, is that the name of it? The nursing home for children that are so disabled. You know, so overwhelming. And so where do you start? And you know, when you go out in your clinicals, if you have a feeling of being overwhelmed, say it, and say it loud that night to the clinical instructor. And go get a communication going that will help you learn. The interaction and the respect that you give to people, and understanding potential, which was discussed in this, are all very vital things for what we do. And it really applies to children, but it applies to everybody. Does anybody have a comment about that documentary, or anything that sticks out in your mind? I mean, there's so much in it, yeah.
I thought it was good when he addressed the part, because like one person was saying that every child should be with the totally included 100%. And I was sitting there thinking but some of them really do need that special interaction and really need a lot of adaptations made in order to facilitate the best learning environment for them. So I thought it was good then that later he addressed it in a different way.
And with the young lady Amanda, I think she walked the border in the school, but they were trying. And you know, for parents, and there was alluded to here a little bit, and the mother was talking about her son with autism. You know, parents they know that they want their child in a classroom where a lot of children have very difficult behaviors, because they will come home. And so your child might be one of them that has the behaviors, but when you put them all together, it sort of exponentially can be a problem, you know, unless there's very, very good staff ratio and management. So we're going to talk about IDEA, and it kind of sounds like, you know, it's easy on paper, but it has a lot of complexities, and I think that this documentary brings it out. And I think that the documentary, the father was very forthright about concerns for middle school and high school. And this documentary now is a number of years old, so it would be really interesting to know where that little boy is today. I thought the mother was exquisitely articulate, and when we talk about IDEA, what rings in my mind is she said, if I did all of the services that I've been asked to do, the PT, the OT, the speech and all, she said, I just want to be his mom. And, you know, sometimes, I think I referenced to Mom that, you know, when I started teaching you this fall, we didn't have a diagnosis, and today we still don't have a diagnosis, but her appointments have been phenomenal. She's been for an MRI, she's been for a urine test, go back and take another urine test, double blood test, NIH, 5 hours, you know, and the MRI was not typical. So they know now that it doesn't have a name, but they know they have a journey, and she's talking to me about all these things she needs to do and what services and who will give her what services, and it's overwhelming to listen to her. I finally said to her, I said, I don't even quite know what to advise you in terms of, here is this 14-month-old child, you don't really know what's wrong with her, you want to give her everything. One person says don't do this, another person says do this. It's a really tough time for a parent. Because ultimately they make their own decisions, but there's an awful lot of opinions coming at you rapidly. And, I just hear, that voice of, I just want to be mom. So, all right, let's look at IDEA quickly here. So, have you've all had discussions of that in some of your classes? It is the law that governs the education for our children with disability. There does have 4 parts, which is just a general provision is A, and D is national effort should be to improve education of children with disabilities. It's Part B and Part C that you hear the most about. Part B was the first one to come into effect, and that was to give that FAPE, or free and appropriate education, to children aged 3 to 21. In some states, Michigan's 25. I don't know what Virginia is. Does anyone know what it is? 21? 21. Yeah. So it may vary. It includes children with disabilities who have been suspended or expelled from school, to relook at them at all times. The process of child find is, the phone call comes in that you have a child that you want to have assessed. There's 45 days by law to come in and evaluate the child. Actually, that's the Part C. So this is more of the school system, and it's going to happen more rapidly. And then the determination of eligibility and educational need for the child, and then begin the service delivery, which is a process of going to the IEP and finding a school placement. You cannot go to your IEP and say, I want to go to Jones Elementary, because that's not the way it goes. You want to say, this is my child, this is my child's needs, what is the best placement for my child? So of course a lot of parents go and they know what school they want for their child. So the game is to describe that school down to the detail and hope that you can match it to what the other side of the team is going to say. So we've talked about least restrictive environment, where the children are included as much as they can, considering the nature of the disability. As Marjorie pointed out, it doesn't work for all children. IEP is a written statement, and it has the level of academic achievement and functional performance. It wants measurable goals, including academic and functional, and the child's progress toward the annual goals to be measured, and how they will be measured, and then it will list all services that the child will get. And that is a working document. And if you have in there that your child is going to have a one-to-one aid, and you find out that the school is providing an aid half of the time, it's against the law. And if you want to, you can start fighting it. And I have families right now with, I suppose it's economically driven, where they're not getting their one-to-one aid. They're not getting some of the services that would be really delineated in the IEP. And the question is, do you have the wherewithal, time, energy, and economics to fight the school for what is in the IEP? So related services are all of these things, from us being PT and OT to counseling to therapeutic rec, transportation, counseling. If it's felt in the IEP that it's needed, these are all the services that can be attained through the school system. The school system is sometimes very careful about recommending things, because if they recommend it, then it's their responsibility. So they move in different ways to make sure a child is having access to the medical care that they need. I haven't worked in the school system, and sometimes I wish I had for just a year to sort of appreciate the rules and regulations, and I think it really is sort of a different experience altogether. This is sort of just a day in the life of, maybe not. watch just about half of this. I'll play about 5 minutes of it. This is actually done out of Montgomery
Emily
County.
Luke is awesome. She's starting a brand new program for us and coming in as a brand new teacher. Emily Luke is awesome. She's starting a brand new program. I would not hire someone coming in as a brand new teacher program. I just think it's hard enough figuring out what to do when you're just beginning.
Okay, so today is a block day. So we will start out with a long art class.
But she's astounding. What impressed us the most was her attitude is always about what students can do, not what they can't do.
Then we'll go out to the grocery store, and as soon as they get back, they'll go to lunch. Right after lunch, job skills, a reading lesson, and they go to gym class at the very end of the day and pack up and go home.
This is a
I
contained
just have so much
community-based
admiration
class.
for this young teacher who just came in and took the bull by the horns.
Here's our schedule for the day. The paraeducators get here around 7 o'clock. So you can just go to the fundamentals like you always do, and we wait for the bus. Good morning, Maya! Good morning, Mariella! Good morning, Marvin! School community-based students are students who have significant cognitive disabilities and sometimes physical disabilities as well, and they're not going to special centers. John, honey, you not feeling good? It's a busy day, and it's a long day. You guys go ahead. I'm going to take John down to the nurse right now. John, hon, okay, calm down. Let's go to the nurse, okay? Let's walk, buddy. And the nurse isn't here yet. Could somebody come and sit with him in the nurse's office? Okay. So, that's sometimes the way we start out our mornings. Hello, everybody! So the goal of the school community-based program is for the students to gain access to the general ed curriculum, mostly in reading, writing, and math. And then, of course, we have the community-based component, so that when they get their certificate, then they can go on and be very functional adults. Do you need to walk to the nurse with me? One thing that happens with my students, they very much can set each other off. So for instance, when John came in and got sick right away, that will frequently result in other students feeling sick all of a sudden or being upset.
It's very intense the first year. You have a new teacher who is managing quite a few things at one time.
Show me where your hands are supposed to be, not on my head. That's right, Marvin, at your sides, let's go.
Even in the school community-based program, expectations are very high for all students, so that puts a lot of pressure on teachers.
Moving to the art class is always harder. I just wish it didn't happen first thing in the morning because this is my planning period. So.
One of the things I always take great pride in with Blake students is how tolerant they are. They're very accepting, they're very tolerant, and the response I see from our kids is, okay, yeah, these are kids in our school. Yeah, they may be a little different, they may have some different needs, but, you know, so what? That's cool.
Thank you for turning around, okay?
Yeah.
The rest of the day, no hugs, hon. Let's do high fives.
Miss Lukey has those students 7 hours a day. They're learning to be adolescents, so you have that kind of behavior.
If John's not feeling well,
John
and
is
he
very
wants
sick.
to make a card for him so he'll feel better.
So she is going to be seeing a whole gamut of emotions throughout the day, probably more so than most parents would see.
I really want them to be able to succeed, particularly in the workplace. All right, where are we going today?
Grocery store.
That's right. I think grocery shopping in particular is just a very important trip. It's an important place for students to be able to feel comfortable, and most of my students are working on different skills. So we'll say hi to the clerk. That's right, Miss Maya. I know. You ready to go grocery shopping? Can? I don't know. What do you want to buy? What is that? Nothing. A carton? Good job, Tom. Why don't you ask him your question, Brandon?
Where are salt?
Go ahead. Good. Very good. Now here's the part where we have to weigh something. Put them down. Every day is different. Every day I kind of have to attack the problem in a different way. So I'm still learning how to really address all of the academic and behavioral needs of my students on a daily basis, but I'm also, as a first-year teacher, a bit overwhelmed by how much I need to learn just about the school system, like what form I need for which purpose, how to find the form, who to ask. I mean, those are things that I think are just going to come with years of being in the system.
I have to go down and feed Maya.
I like working with a lot of other adults. It's really nice because they're all very willing to give me feedback on how I'm doing and give me great suggestions with these kids. Sometimes you have to be so creative. And I'll have somebody from InteractCom or the speech pathologist come in and I'll ask her, you know, how can we do this? Something's not working. Someone will have a great idea. So that's what the great thing about it is. The only thing I have trouble with is keeping it all straight.
Time management is a major piece that we work with new teachers. Because you're not just working with the student who you can mold, but you're also working with another adult who has their idea of what should be going on in the classroom.
If I had a goal,
So that's a little picture of a more contained classroom within the regular high school. And the kids are brought into different classes for more inclusion. A 504 plan is such that you adapt the environment and you adapt the needs for the child so that they can perform at the best level. So to qualify, there must be a physical, probably more a physical impairment, which substantially limits one of the major life activities. All students eligible for IDEA are also eligible or covered under 504, which is really accommodations and environmental changes. But not all students that qualify for 504 are eligible for under IDEA and have an IEP. And I give you an example that a child with level 4 receives services under IDEA and section 504 because of their multiple needs for educational support. Whereas a child with level 2 or level 1 with age-appropriate cognitive skills may need nothing in terms of the educational accommodations. But they may need extra time to get down the hall. They may need to make sure they have accommodations to move about the building appropriately. So they'd be under a whole different plan. That's, again, another document. It is similar to IEP as it provides a plan for the school district to follow, providing accommodations to a qualified student with a known disability. So the differences between Part B and Part C, we'll talk a little bit about Part C, is just age. Part C is the birth to age 3, and in it, it has a different emphasis in that it really looks at the family more so than probably the Part B area. But it's to enhance the development of infants and toddlers, to minimize their developmental delay, and to recognize the significance of brain development at the early ages. If we compare them, an IEP is part of Part B, and the IFSP, which is the Individual Family Service Plan, is part of Part C, where the family is asked to help coordinate the goals and to do a lot of the servicing through this coaching model that we're going to talk about. So it's any child, if your child calls in, a family calls in and there's a concern about any delays or anything about their child, a team will come out to make the first evaluation and make recommendations on services that might be needed. An individual family service plan is drawn up, which is a written document about the child's status, the family information, the services that are going to be given. A service coordinator is identified. And then there's a very, much like the transition at age 14 to begin planning for 21, there's a transition team in the 0 to 3 to plan to move that child from that Part C to Part B, where they enter more into the educational system and classrooms. So services rendered through Part C are very similar to Part B, and we have all those related services that we talked about before. The same thing can be available. The whole emphasis on the early intervention 0 to 3 comes from the concept of natural environments and families, that the most ideal place for a child to learn is within their own environment. And it can be a playground or the home or the daycare, rather than, I suppose, an institution. But of course, we have a private practice where kids come to our office, but it's very home oriented in terms of toys and play and structure for the child, and they do get to interact with each other from time to time. So, it's all part of where that child can sort of naturally evolve. We're always thinking, what can this child do at home that's 24/7 that's going to really help move them along the continuum? So it's been found that learning opportunities that are interesting and engaging and competence producing and mastery oriented have more successful outcomes. So we're constantly looking toward function for our children. We are looking for the ability to generalize something and carry it over for motor learning. And yet we've learned in our motor learning discussions that we oftentimes begin looking for more performance and block practice, and then we expand it for the children. At the meeting yesterday, the little boy that's in the wheelchair, I really asked for more integration of his gross motor in the classroom, and it was a very open teacher, because she had just said it works really well to move him from this place to this place in the classroom in his wheelchair. And I had taken note of it because I knew I was going to bring it up, and I said, because he has such a good para, could we have the PT really work closely with getting him out of his chair on a regular basis during the classroom day to stand or to take a few steps. It doesn't have to be much, just so that he is not in that chair all day long. And she was very generous about it and said she'd be more than happy to begin looking at that aspect. So I'll probably go in and work with the school PT and the teacher, and I'm excited about it, because once you get those children moving and you get them up more, whether it's in the home or in the classroom, we see changes. It's kind of logical, really. So family-centered is where it's at, and not only is it family-centered within the educational system, as you go out into your medical model complexes, the family is driving a great deal of things about our health care. More and more of care is going to be more toward ambulatory care. I don't know if you've had the experience in the acute care hospitals now where, you go into the ER and they think you need to be admitted. You go into what's called observation versus admitted, and it's a state regulation in Maryland, and you have to be in an observation sort of facility for 24 hours, and if they feel that you really need to be admitted, then you're admitted. If not, you go home, and there's different reimbursement rates for this kind of status. So the number of people that are in a hospital at any given time may begin to change as we bring our healthcare more and more toward different facilities and ambulatory care and family-centered activities. So our role is, in the Part C, the role is to assist and to teach the family how to be caretakers and how to promote the families to doing the PT, the speech, the feeding, the cognitive. So it's really easy to understand why a mother can be totally overwhelmed. And, I'm not so sure. There's a recent study by Harbone, I'm trying to think of her first name, but anyway, and she looked at development of postural control and sitting with infants, and I think I mentioned this. And her study looked at kind of a home-based coaching model versus a therapist handling intervention, parents observing. And the kids that had the intervention did better in acquisition of the skill in that study. That would speak against the coaching per se. So, there's a lot we don't know about how to best treat children. And obviously, some parents kind of just really get it. And some parents just find handling of the child to facilitate movement that the child doesn't intuitively have really hard. I mean, even as something as simple as, I had this mother that was lovely, and she's a lawyer, and she's returning to work, and her child just had torticollis. So I was showing her how to stretch, and then I said, could you do it? And I'm like, give me this baby back again, And, it's frustrating to me because it becomes so second nature to us, and I'm like, okay, let's start this again. But I think we tried it 3 or 4 times, and I don't think she was going to stretch him correctly. And she looked like she was really awkward, so we had to find some other way for her to do it. So I'm going to end a little bit on this this is a bit of a satirical and slightly sarcastic look at typical conversation between a parent and special needs and an official in a school district. But I think it highlights a little bit of, well, I don't know if it, remember this is satirical, so you might recognize this kind of format.
Hello, I am concerned. that my son Zachary is having problems in school.
All children have problems in school sometimes. Your child
Have you
is
seen-
fine.
You've not seen this video then?
From the school district.
But he is in 3rd grade, and he still cannot read.
Your child is fine. You worry too much.
He gets headaches and cries a lot.
I get headaches too. And sometimes I cry. Jacob is fine.
His name is Zachary, and I think he needs to be tested for a learning disability. He cannot read.
He just needs to try harder. It is probably your fault. You help him too much.
I do not think it is my fault. I think he might need special help. Please evaluate him.
We evaluated Jacob 4 or 5 years ago, and he was fine.
My son's name is Zachary, and he was not here 4 years ago. I think you are thinking of a different student.
Okay. We will test him next year. It is too late to test him this year. It is almost summer.
It is February.
It is almost summer. We do not have time to test him. We will test him next year.
It is snowing. It is not almost summer. I think you do not want to test him.
Okay. We will test him. But first you must sign many papers. You must come to my office and sign these many papers.
Okay. I will come tomorrow.
Do not do that. It will not waste enough time. It will be slower if I mail the many papers to you. Then you will sign them and mail them to me. Then we will test Jacob.
Zachary, when will you test him?
I do not know. We are very busy. It is almost summer.
Who will do the testing on my child?
Dr. Johnson. He is very smart. He has a PhD. He will tell you that Jacob is fine and that his problems are your fault. You should not help him so much at home. You worry too much. You give Jacob headaches and make him cry.
My son's name is Zachary, and Dr. Johnson has never met him. How do you know what Dr. Johnson will say?
Because that is what he always says. He is very smart. He has a PhD.
What if I do not agree with Dr. Johnson's report?
Dr. Johnson is very smart. He has a PhD. You cannot disagree with him. You do not have a PhD.
Actually, I do have a PhD.
Dr. Johnson has a beard. You do not have a beard.
If I disagree with Dr. Johnson's report, I will get an independent evaluation, and I will ask the district to pay for it.
We will not pay for it. We do not pay for things. Things are expensive.
I am going to hire a lawyer to help me.
Do not do that. If you hire a lawyer, it will damage our relationship.
You have already damaged the relationship by not teaching Zachary to read. I am going to hire a lawyer.
We also have a lawyer. She is very smart. She is very expensive. She will give you a headache and make you cry.
I do not care. My lawyer is smart too. And the law is on my side.
Our lawyer charges $400 per hour. Your lawyer charges less. Our lawyer is better.
Now I understand why my son cannot read. I am going to hire the attorneys at Frankel and Kirschenbaum. They will make you teach my son to read. If you cannot teach him to read, you will pay for him to go to private school. That will be very expensive. The school board will cry.
We do not pay for private schools. We are not a bank. We have many children to teach. Jacob is fine. He does not need help. It is your fault. You help him too much. We are educators and we are very smart. We know what is best for Jacob. Dr. Johnson has a beard.
My son's name is Zachary. Goodbye. I am going to call Frankel and Kirschenbaum.
Have a nice summer.
So, it is satirical, but I'm telling you that sometimes it feels like that for some of the families. And the time element, like, we can't test him until next year because it's almost summer. That's the way the school year goes. And in terms of physical therapy, like, a child needs equipment, and so the therapist is going to get the equipment, and it's September, and maybe we see it sometimes by November or December. It's amazing how things just, time flies, and I'm sure that it's a lot of moving things around and getting everything organized. So when you're in a situation like I was yesterday, where everybody seemed to be on board, it was just fantastic. So it's a complex system, and for those of you who have had some experience with it, I would welcome any comments, but it's a little bit about all the laws that affect our kids from an educational point of view, and I appreciate it today. It's a little bit different. Okay, so next week we will begin to wrap things up. There are 4 pathologies I didn't cover, and I could drill them in 15 minutes, but I think that you probably don't want that. I think you do not want that. It is almost summer, we have to end. But I do have the questions that were written by your fellow students, and what I think I'll do is I'll hand them out to you next week. And what I probably won't ask anything major about any of those, it's concussion, scoliosis, which I think you've had some of. The juvenile idiopathic arthritis, which I really didn't want to get to. Maybe I will get to that yet. And the fourth one is developmental hip dysplasia, which I think we had a lot of, and we're talking a little bit about the biomechanics of the hip and everything. So you do have those PowerPoints, so you might want to look at them, and then I'll give you the questions next week to just look at them, and then they pick some of those off for the exam as an incentive, okay? Any comments or questions? All right, thank you very much for your flexibility, I appreciate it.
Thank you.